Services are going to be much more extensive than they are now. We'll be able to offer a much wider range of care and support than people currently receive at the present time. We are looking to root our services in local communities and connect to communities in a way that we haven't been able to do previously. And by doing that, we hope that people will be able to access services much more quickly and much more simply than they've done before.
Service users will have access to a much larger mental health care team, a much more responsive mental health care team and a local team. The primary care team again will see a locally embedded team that offers much more proactive rather than reactive care, and all of these groups have been key in designing this new service.
Closer integration will be fantastic. I think really successful working together is all about relationships, and it's obviously easier to build relationships with people when you're meeting them regularly. You might be in the same team, you might have multidisciplinary meetings with people. Much easier to negotiate and to share creativity, exchange information and ideas, and ultimately that's far better for the people that we are serving and working for our residents. It means they may not have to repeat their story, they shouldn't have to keep telling different professionals the same thing. So where we can share information, share ideas and support each other, that can only be a good thing.
This way we can address things with regards to physical health, mental health, general well-being, so that it allows you to have care within the community at the right time, at the right place.
As a peer coach, as someone with lived experience, we tend to support people with mental illnesses, both emotionally and in an advocacy way, try to counsel them, point them in the right direction for them to improve their quality of life. We may signpost them to different organisations to try and improve things for them.
So we'll be wrapping our community services much closer around GPs, working much closer with our colleagues in primary care. We'll also be working much more in partnership with our local voluntary sector colleagues, so there'll be much more access to local community grassroots organisations.
We'll be working very closely with the primary care network as well and the voluntary sectors. So we are hoping to actually make every contact count. So every opportunity that we actually have for that particular patient, they'll be able to actually resolve quite a few of their needs.
Our services are embedded within community centres, allowing people to access services in the comfort of their own communities, in their own language and their own cultural backgrounds, and being very reflective of their needs, so that people are then able to receive support when and as they need it.
For you as a GP, what this will really mean is that moving the services from secondary care within to the community, it will really improve the general care that we're able to provide service users. It will be able to take a much more holistic approach, both physical, mental, general, emotional well-being.
Most of us that have joined mental health services have got a really deep commitment to supporting people with mental health needs, and over the coming years, now's our chance to support a wider range of people and offer a wider range of treatment, care and support that will support those people and improve outcomes for them. It's a great time to be in mental health services.